Hello, this is Dr. Ernst von Schwarz. Let me briefly talk today about chest pain. Chest pain could be any sensation in the chest in men or women. Any pressure, any stabbing pain is for us as cardiologists always of concern. Oftentimes it goes to the left side, to the left shoulder. It can distribute to the neck. So what is the reason for the chest pain? So there's different structures in the chest, of course. There's a chest wall, there's the muscle layers, there's the nerves, there's the ribs. So chest pain theoretically could be caused by some musculoskeletal reasons, by the chest wall or its structures. But there's of course other structures below the chest wall and below the rib cage, as you can see here in the chest. There's the lungs, of course. Infections or inflammations of the lungs, of the pleura, the layer which covers the lung, which we call pleuritis, for example, can cause severe chest pain. Often not localized in the middle, but more on either side. But more importantly for us as cardiologists and in general is, of course, the organ in the center of the chest, which is the heart. And any chest pain theoretically can be caused by a problem with the heart. So oftentimes for us as cardiologists it is difficult to distinguish, is the pain or the pressure in the chest related really to the chest wall, to the musculoskeletal system, to the lungs or the heart. And the heart as a central organ, of course, has our main interest, because if chest pain is related to the heart, then it might be potentially a life-threatening condition. So what do? We have to assess the structures of the heart, and what we are interested in is of course those little blood vessels here, which we call the coronary arteries. There's one on the left side which divides in two branches, one on the right side. So for any chest pain we want to make sure that the cause of the pain is not lack of oxygen in the heart caused by a possible blockage in one of the arteries. And there's different relatively simple tests for us to distinguish this. We do a physical examination, we do an EKG, sometimes we do an echocardiogram, and oftentimes we do a stress test. So if you have any kind of chest pain, in particular if you have risk factors for coronary disease, such as a family history, diabetes, smoking, high blood pressure, high cholesterol, then you better see your cardiologist, talk to your primary care physician. Let's check that out. Not all chest pain, of course, is coming from the heart, but if it is, then we better be proactive to prevent possible damage like a heart attack or even death. Thank you very much.